The state's peak medical body represents thousands of doctors across the state. In the last 12 months, the Australian Medical Association of Queensland has dealt with issues ranging from Queensland Health's ailing payroll system to the emotional fallout from natural disasters. Kathy McLeish spoke to the organisation's new president, Dr Richard Kidd, about his prognosis for doctors and patients in the year ahead.
You've practiced in Papua New Guinea and Serena, so you have rural and remote experience, and you're a GP who still does house calls. What will that experience, what will you bring from that experience to the presidency?
Well, it's a GP who's been involved in overseas medicine and rural medicine, general practice that's very much integrated with a number of my specialty colleagues. I think I bring a very broad perspective and I think a fairly deep understanding through all the years of experience of a number of issues that are impacting on medicine.
The health reform is still underway and obviously there are some big issues there for doctors. What challenges do you see in that reform for the AMAQ this year?
At the moment, I think it's very important that doctors are involved at every level to try to mitigate harm. There are a possibility of a number of unintended consequences with some of these reform things, and it's very important that there are doctors there who have got experience, who have got understanding of how systems work, so that they can advocate for their patients and for their colleagues.
The announcement of the health reforms came with a promise of local input. Do you have concerns that that's not going to happen?
I'm advocating for that very strongly here in Queensland. Queensland Health, with the previous health minister, and I'm hoping very much with our new health minister, have been very supportive of the idea that having local clinicians on the local hospital networks and general practitioners on the boards of the Medicare locals brings a lot of positives to the table. It's not a view that's shared around the country. In Victoria, they have actively tried to exclude local clinicians from the local hospital networks, or the equivalents of them down there, their hospital boards. We don't want to see that happen here. Imagine if you're living in Mount Isa and you're a doctor there who really wants to help contribute in a positive way to the health outcomes for your area, and you're excluded. So I think Queensland Health, with Mick Reid and Paul Lucas in the past, they both publicly stated that they see that, and they've been very keen to have that local clinician input, but I think we have to keep reminding them that that's important.
You're taking on the AMAQ presidency in a year of big challenges for Queensland, not the least of which has been the Queensland disasters. 3 months ago, the organisation launched the See the Signs campaign. Do you have feedback on how that's going and how significant the need is?
During the floods and just afterwards, and with the cyclone Yazi, we became aware that a lot of people were impacted quite badly, even who weren't directly affected by the floods. Children had seen a lot of the media coverage, and every time some heavy rain came, there were children all around Queensland who were terrified that their house would be the next one to be washed away, that they might be the ones who would lose a little brother or sister. So we've had an interesting new development that with such extensive media coverage, which was important, there's actually been a direct impact on the health of our children and also other people, to say nothing of the ones who have been directly affected and are trying to rebuild their lives and their occupations. And we know that from previous disasters, and certainly some work done overseas, that it could take up to 18 months to see the fallout mentally and emotionally from these kinds of disasters. And that's why we've developed the See the Signs campaign. We've had some positive feedback that it's helping, and as I said, in the next 12 months we do expect to see a lot more fallout from the disasters, and we want to be prepared. We want to have psychological services, general practices that are well resourced and are able to meet the demand that's going to be there.
You've raised concerns about Australia's suicide rates and chronic underfunding in mental health and Indigenous health. Are they concerns that you'll be pursuing this year?
Yes, it's one of the things I really want to do something about during this coming year. As I see it, we have quite rightly put quite a lot of money into things like reducing the road toll. And at the moment, there are more people dying from suicide than are killed on the roads each year. So I'd like to see us put at least as much money and commitment and resources into trying to reduce the suicide rate, trying to prevent suicides. And there are a number of ways we can do that, but particularly encouraging and supporting general practice, which is often the first port of call when people are starting down that path where they could end up in a tragic situation and making a terrible choice.
How much work do you see on the ongoing Queensland health pay debacle this year for the AMAQ?
Yes, it's been an ongoing festering sore that's caused so much pain and financial uncertainty for people who have been working in the health services in good faith. Imagine what other professions people would continue to work for their patients when they're not getting paid or they're getting terribly underpaid. Any other employer would be in front of some kind of court within a couple of weeks if they didn't pay their employees. I am hoping to work on a daily basis with Queensland Health, with some senior people in Queensland Health, to try to find a good way forward and really reduce the harm.